I'm Dr. Julius Johnson Weaver. My pronouns are he, they. I am a Black transgender non-binary man. I'm a board certified family physician that owns my own practice called Resolve MD in Columbia, Maryland. And I run a gender affirming care program as well. This idea of making sure we ask patients what they want. As everyone knows, a transgender and a gender diverse person all can have a very diverse set of goals in terms of what their gender identity means to them and how they want to express that identity. And so I typically in sort of my own world ask them sort of, what are your goals? What's going to give you that sort of gender euphoria? What's going to make you feel like you belong and that your gender identity is connected? And that's a great place to start. And you know, often we then sort of move socially, sort of what we can do in a way that doesn't necessarily mean medication right away, but in ways that can be helpful, especially when we're talking about youth. You know, it could be as simple as sort of dressing differently or using their chosen name and sort of getting their parents on board to use their chosen name. So we typically start with sort of social. You know, is the school affirming to them? Do they have a job? Is their job affirming? So in what areas are they feeling affirmed? And again, it typically is, you know, pronouns, use of correct pronouns, use of correct chosen name. And then we can, you know, over time, especially with adults, we're talking about hormones and what are their goals with the use of hormones. And that really varies, and it's really great, especially now as we are sort of seeing more folks come forward as non-binary. And I think that that's just because the language is there. You know, certainly we've existed for a very long time, but as we see that, then, you know, it's not very cut and dry, sort of stereotypic, sort of binary view of sort of what a man, you know, is and what a woman is, but sort of where in that sort of spectrum are you? And so, yes, so socially, medically with hormones, and then, you know, in the primary care setting, we're talking about referrals when we want to do anything surgically. For me, in a primary care setting, it's similar. You know, people need to see themselves, and they need to know very quickly that a space is safe. Going to see a doctor is a very vulnerable place to be, and so symbols are wonderful. I like to make sure there's imagery present. So right now, people sort of meet you online first, looking at websites or social media pages, and making sure that the photos that I pick up are very diverse. They're going to show queer people, they're going to show trans people, they're going to be racially diverse. And so that's very important. And then the language, that is a big one too, making sure on either my website, again, my social media posts, I'm using either gender neutral language or very expansive language. And so I think those are two very big sort of beginners that kind of tell people, hey, this is an inclusive, welcoming space that I would be entering. This is a big part of my care as a primary care physician who is a minority racially. And actually having lived, I'm a late blooming transgender person, so actually having lived many decades, you know, as a woman. And so when I look at the intersection of my own identities, you know, having been socialized as a woman, so meeting sexism, being Black, so meeting racism, and then now we're adding this identity of being transgender, I think I've always worked from a lens of advocacy and social justice because of my own intersectional identities. And that's sort of what you get in my office, sort of this willing to understand how those identities are going to impact your care. The transgender and gender diverse community is very, very diverse. And so if you have someone on one level of one economic level, or again, as I said, a person of color, what are the barriers that are they going to face? And we know when you hold multiple marginalized identities, it is harder to access healthcare. You know, it's harder to access, you know, doctors where you may be able to get into to get gender affirming care easily or not. So So really looking at that whole person and understanding that that may make them also not feel as confident in themselves, advocating for themselves, what's going to be the cost barriers. When you have racial identities, is there a strong religious background that's going to sort of mean that their parents or their family around them aren't going to support them? So kind of looking, just as Dr. Nagy is saying, you're kind of trying to get all of the information, not make too many assumptions, but really understand that all of these identities together can honestly cause some obstacles to care, and you have to sort of be aware of them. I recently went to, and so this is on a personal level, I recently went to, used a male locker room for the first time. And I've gone to men's bathrooms, that's not a problem. But a locker room where you're, changing, showering, that kind of thing is at a spa, was the first time. And there was a lot of, euphoria as I was able to do it. And I was walking through and thinking, I'm passing, I'm okay, I'm safe, right? So this is what I'm saying to myself. And it dawned on me that I was happy that I was there. I was euphoric that I was able to use it, but I also had to pass to use it, right? To feel safe. And so my hope for the future is actually a little complex in the sense that I kind of hope trans folks don't have to pass. I'm a proud trans person, and I want to feel safe as a trans person using the locker rooms, the bathrooms that align with my gender identity. I don't want to dismiss that part of me. And so that is actually my strong hope for the future.